So I took a very real interest in cardiovascular disease, and the reason for that was I got the opportunity to work with the Heart and Stroke Foundation. And I was very inspired by their work. I was also very encouraged by the fact that unlike cancer, which is actually what I focused my master's degree on, I felt that with cardiology, with cardiovascular disease, there was a real opportunity to prevent the disease. In fairness, many things have changed with cancer, but at that time, it looked much more optimistic to work in cardiovascular disease. And I think like all young people, you want to make a difference, you want to do something positive. So I have focused on cardiovascular disease actually all my life. You know, first you just focus on cardiovascular disease and then you want to try and pick out the niche that you're most interested in. And I very quickly focused on women. And the reason I focused on women is because traditionally, cardiovascular disease, especially heart disease, has been viewed as a man's disease. And it became very clear to me very early on that that is indeed not the case. And as a matter of fact, in the last few years, we now know that women are more likely to die of heart disease than any other cancer, and there are more women dying of heart disease than men. So clearly, it remains a man's disease, but it should be the single biggest issue for women. So that really inspired me to focus on that. The other thing that really attracted me was I soon became aware, as I delved into this area more, that the difference between men and women is the most magnified amongst the youngest age group. So as men and women get older, the difference in their likelihood of dying from heart disease, that gap, if you will, gets much smaller. But amongst younger people, so for heart disease, younger is defined as 55 years of age and younger. Amongst that group, the gap between men and women is very wide, and women do much, much worse than men. They're more likely to die than men. They're less likely to make a full recovery if, for example, they have a heart attack. Even if they have open heart surgery, their recovery after open heart surgery is not as good. And we don't understand why. So we have some clues. We know, for example, women are more likely to have hypertension, which is high blood pressure. We know women are more likely to have diabetes. Unfortunately, women do smoke, not as much as men, but they do smoke. But even when you take all of that into account, we still can't explain why women do so much worse. So my current research actually focuses on trying to understand if it's not the diabetes or the hypertension or the smoking, what might it be? And we're trying to focus down on a group of variables that we call psychosocial variables. And psychosocial variables are things like anxiety, stress, depression, social support. And actually social support is very interesting to me. We do know that if, for example, my husband had heart disease, he would be very well supported by me. It seems to be a societal thing that if I had heart disease, it would be much more difficult for my husband to support me. It's not part of how our society is structured. The women are the nurturers and the providers and the helpers, and generally in our society, the men don't play that role. So social support, I think, is a very big issue. Think of it when you have a heart attack and you go home and you're going through recovery, social support becomes very important. Improve social support, very good question. That's a challenge, particularly for young women. And the reason I say that is we're finding that these women that are 55 years of age and younger, they have multiple roles. Many of them work. Many of them have young children. And then on top of that, some of them are already looking after their elderly parents at the same time. So you can imagine it's very difficult to provide support when you have that many things you're responsible for. That, I think, has to be a societal initiative rather than an individual researcher's initiative. Somehow we have to make society understand in the broader context, if women are to recover and return to the workforce and everything else that they do, we need to provide the sort of supports they need. So perhaps daycare for their children or respite care so that they have some time for themselves to recover.